Adrenergic antagonists inhibit the sympathetic nervous system and produce rest and digest effects. These drugs are used in the management of hypertension, angina pectoris, myocardial infarction, and heart failure. They also serve limited roles in the pharmacotherapy of benign prostate hyperplasia, thyroid storm, and glaucoma. Overall, most of these drugs' therapeutic actions are related to the cardiovascular system. Adrenergic antagonists compete with norepinephrine for the adrenergic receptors. By blocking norepinephrine from these receptor sites, symptoms of the fight or flight response are prevented. Different types of adrenergic antagonists include alpha-1 antagonist, non-selective, and selective beta blockers.
Alpha-adrenergic antagonist. Prazosin is the prototype drug of alpha-adrenergic antagonist. It's located on arterial smooth muscle. Blocking alpha receptors will dilate blood vessels, lowering blood pressure, treating hypertension. In addition to dilating vascular smooth muscle, they relax smooth muscle in the base of the bladder and prostate, increasing urinary flow for those who have difficulty voiding and those with benign prostate hyperplasia. Alpha-adrenergic antagonists also cause vasoconstriction and inhibit ejaculation.
Beta-1 blockers are selective for the heart. They work by slowing cardiac conduction by depressing AV conduction, having a negative dromotropic effect. It causes a decrease in heart rate, having a negative chronotropic effect. It also decreases the force of cardiac contraction, having a negative inotropic effect. The prototype drug is metoprolol, also known as Lipressor or Toprol. It is a selective beta-1 adrenergic antagonist indicated for angina pectoris, heart failure, hypertension, and myocardial infarction.
Non-selective beta blockers work both on the heart and lungs. These drugs decrease myocardial contractility, which decreases cardiac output. The release of renin by the kidneys is prevented. They block alpha-1 adrenergic receptors, which relaxes artery smooth muscle, and they reduce sympathetic output from the vasomotor center in the brain. These drugs are indicated for the treatment of hypertension, chronic angina pectoris, dysrhythmias, and prophylaxis of migraines and myocardial infarctions. The prototype non-selective beta blocker is propranolol.
Thanks for listening. Sincerely,
Alice,
Mike,
Michelle.
and Justin.